Hey everybody, welcome to Talking Poop, the podcast where we talk about movies, music, and media. I'm your host, Jason Bromley, and this episode we're going to be continuing our interview with Persephone. She is an autopsy technician in the state of Arizona, and she graced us with some of her time to talk about her profession, and since this is a movie show, we related it to the film The Autopsy of Jane Doe, starring Brian Cox and Emile Hirsch. So this is the second part of the interview, so if you haven't heard the first part, go on back to iTunes or Spotify, download episode 49, which is the first part of our interview. This is episode 50, and without further ado, let's get right back into the interview with Persephone.
Can you imagine as an actress being like that actress just played a dead body. She didn't move, she had no lines, and her job was to be totally naked.
So I wonder, and this might ruin more movie stereotypes for you, and I'm really sorry about this. I don't know for sure because I'm not in the movie business, so I could be wrong about this. But except for when they're doing some of like the super close-up stuff, I wonder how much of it is actually just a dummy. And especially like when they're cutting her open and everything, some of that has to be just a dummy because obviously they're not actually cutting her open.
Well, yeah. So, and in this movie particularly, they said that she looked like she had distortion from a corset.
Yeah.
So I kind of wondered, like, and there was a couple scenes where they showed that, like, her hips were out farther than her ribs. So I wondered, like, that had to have been a dummy for those parts.
I mean, depending on the actress they use, there are some people who, like, their body shape is just naturally, like, their waistline is a lot slimmer than other people. There are people who have, I've heard stories, I haven't seen it in a person ever, I've heard stories from other people, actually, that their parents, their mothers, usually were in a corset for so long that you can't not be in a corset when you're still alive because your spine just can't support your body anymore.
Oh, wow.
So they still had to wear a corset on a regular basis because their body couldn't support themselves anymore because their bones had been so disfigured by the corset.
Right.
So, you know, some people even still wear corsets nowadays to do waist training, and I really don't recommend that. That is not healthy at all. It's not good for your bones at all, but it still happens. Right. That could be a thing that someone actually does. In this movie, it actually had a storyline behind it, but... Yeah.
So they opened up her mouth, which, when rigor mortis sets in, can your jaw just, like, open up like that, or do you have, like, lockjaw?
So they already said before they did that she didn't have any more rigor mortis present, which would have been accurate, especially for her weird situation going on. Her jaw was weird in the fact that, like, it stayed closed until they opened it right then.
Yeah.
Where, like, rigor mortis would make all your muscles tense up, and her jaw would be really hard to open. I've had some people where we've had to look in their mouth for whatever reason, and you have to find ways to get those muscles to relax, which is really, it's not nice. I feel really bad when I have to do it, and I'm sorry to people who I have to do it to, but you have to get their mouth to open so the doctor can see what's going on inside there. And if their rigor mortis has set in and they're in the middle of, because rigor mortis is like a whole staged process where it starts at a certain amount of time, roughly. It stays for a certain amount of time and then it releases after a certain amount of time. And those are always different for different people in different situations. It's not necessarily a perfectly timed thing. But what was weird for her was her rigor mortis had completely gone away, but her jaw still sat shut easily. And then it opened super, super, super easily and super wide and everything. I thought that was really weird.
And stayed that way. They opened it and it stayed open.
Yeah, that was super weird. They opened her mouth and it stayed that way, and they opened her eyelids and they stayed that way too. Because the eyelids are another thing. Like, they have muscles too, obviously. And if you die with your eyes closed, your eyes are more likely to stay shut. It's just a thing. Like, it depends on the person and the situation that they die in. But honestly, sometimes it's not easy to get the eyes to stay open or the eyes to stay closed. So that was really weird that her eyes just, and her eyes and her mouth just stayed wide open after they opened it. That was odd.
So I didn't know that rigor mortis went away. I thought that once it set in, it was always there. So is it
Nope.
like lactic acid in the muscles or something like that? Or
Yeah, it's a whole chemical process within your muscles that you're releasing. I want to say it's a lot of sodium and potassium, and it's just a whole exchange of chemicals that your body is now just releasing all these chemicals. So part of it is they're releasing the chemicals so your muscles start to lock up and tense up and everything. And for different people, that can manifest in different ways. There are some guys, some girls too, but I've mostly experienced it with guys who have more muscle than they do fat. And when they lock up in rigor mortis, it is impossible to move like their arm if you need to fingerprint them or something. Like, they are so stuck in whatever position because their muscles tensed up so much and they are so muscly that it's so hard to move their muscles. And then other people are easier, but again, that also depends on where in the rigor mortis process they're in. So
that's how I'd be, because I'm so muscly that I would definitely be in that position. So
yeah, sure, I'll take your word for it.
Yeah. So wait a minute. Okay, here comes another totally inappropriate question, but just popped in there. So does rigor mortis give you a boner?
Not that I've seen. I've heard it can happen. I've been working the job for 4 years, and I haven't seen just like a straight up boner from someone who's not decomposing. Sometimes when you're decomposing, all the gases in your body move around, and that inflates different areas in your body. I've seen that, which is disturbing and kind of sad. But I haven't seen it's a thing that can happen, and I mean it makes sense medically and everything because it's all muscle down there.
Right.
I haven't seen it though. Other people have. I have not seen it.
Oh man. Okay. So they open up her mouth and her tongue has been removed. What did you think of that scene? Did that look legit, or did that look totally fake and weird?
It looked weird, but I've never come across someone who's had their tongue removed like that. So I don't know how exactly it would look like if someone had cut off their tongue beforehand. I've never really seen that. So I'm not sure how exactly that would look, but it did look weird. I don't know how accurate that would be.
So people don't like bite their tongues off in car accidents?
They can bite through their tongue. I haven't seen one been completely bitten off. I've seen people like bite through it, but it's still attached later. Yeah,
that's
kind of
gross.
sucks. Yeah, kind of gross, and kind of, I mean, that really must not have been fun. I really hope they weren't feeling anything at that point, because like I said, like, my thing is if the people can feel what's happened to them, that really bothers me.
Right, right. So what about the eyes? Her eyes were all like milky and scary zombie looking. Did the people get scary zombie eyes?
They cloud over, and that's another one of the chemical processes that happens. It doesn't necessarily happen to every single person. It happens, it's just a chemical breakdown in the body, and sometimes it clears up, sometimes it doesn't happen, sometimes it happens, like your eyes just cloud over as part of your body, as all the chemicals are decomposing in your body. Because once you die, your body starts the decomposition process. You don't necessarily get super gross right away. It depends on the situation, but that can take more time. But your body just naturally starts to decompose and releases chemicals and everything else. So that is a natural process. Yeah. Those were like super clouded over specifically to the iris, which was kind of weird, and specifically to her, like the one part of her eye. That was really, really weird. Because it's usually kind of across your entire eye, and you can kind of see it on the whites of your eye. But no, that's normal. It wasn't normal for her stage, but it kind of fits with her storyline and the whole horror movie thing. Right. So I kind of let it slide. I was like, well, that's kind of odd that she's been dead for however long and she still has this happening. But yeah, okay, sure, whatever.
Right. So when they're looking in her mouth, they notice that she's missing a tooth. That leads to a question I have. You always hear that, like, when people are too decomposed to, like, be able to tell who they are or whatever, that they check their dental records. But how can people's teeth tell who they are?
So everyone's teeth grow in differently, and you have different dental surgeries done, and it's not an exact science. Like, you can't just identify every single person based off of their teeth. It's like fingerprints, where if you can get fingerprints, usually that's an easier way to identify someone. And we usually try to go for that first. If they're too decomposed for fingerprints, if their fingers are just, because there's a point in the decomposition process where your skin, just no matter what you do, you can't get the fingerprints back. because there are ways to try to get fingerprints to come back and everything, but there is a point where you can't get fingerprints. And then you have to rely on things like surgeries. If they have like an implant in their hip or in their knee or something else, you can go off of that. And you can go off of dentals if they've seen a dentist within any amount of time. Usually you can try to go off their dental records and compare and see if they match, because not everyone's mouth is the same, especially when they do those dental x-rays, especially if you've had surgery in your mouth and everything else. So it can be a tool to use towards identification. It's not necessarily done on every unidentified person, and it's not necessarily the number one thing that gets you identified. Like, it might be able to get you identified. It just depends on if you've seen a dentist, and if they have your records, and it's something that, which they did weird in the movie. They did a lot of analyzing themselves, and like he took the impressions himself and everything, which is really weird, at least to me, because in our office we have forensic anthropologists, and in some offices they even have forensic odontologists, which are the teeth people. They specifically do teeth. Our forensic anthropologists study human bones and everything else like that, and they can, based on dental records and dental impressions and stuff like that. Usually dental x-rays. Dental impressions aren't really done anymore. It's more x-rays. They can identify people off of those. But that's very specific thing. That's something that just the regular pathologist probably wouldn't be able to do. But he was also a coroner in this movie, so I'm not sure exactly his qualifications. Maybe he studied dentistry in his younger life.
He was everything. He was a detective. He was
Yeah, some of that was really weird. Like, they were analyzing a whole bunch of stuff that wouldn't just be analyzed in-house. That was odd.
Right.
Like, they had a fiber from something that you saw later in the movie, but they like threw it under a microscope super fast and were like analyzing it and everything, and I was like, no.
Yeah.
No, that actually does get sent out to a lab for someone who's specialized. That's the thing about like any kind of medical field, especially in America, it's very specialized.
Right.
So even though our doctors have gone through a whole bunch of training to become a doctor, they've gone through a regular residency, they've gone through a fellowship and everything else, they are very specialized with forensic pathology. And if it came to them like diagnosing a regular person, they might have a general idea, but they're not specialized in certain fields. So like they can't tell you a whole bunch about cardiac diseases in a living person. They can tell you a lot of stuff after the fact. And our doctors are probably more knowledgeable because they have to be knowledgeable about everything, especially after someone dies. So they do know about cardiac problems, and they do know about lung problems, and they do know about certain diseases, but they're not a doctor for the heart, so they're not going to know everything about the heart, you know?
Right.
So they're specialized in their own thing.
Right.
It's different for everybody. So that was weird that they were doing all this specialized investigative. That just didn't seem real to me.
It started and stopped with them.
You're right.
Whenever I see, like, they found a girl, like, in the park and she was dead, and they're trying to determine how she was killed, they always are like, oh, she was raped. And it's like, well, how the hell did they know that?
There are certain signs on the body, like I said. I don't know the specifics because I'm not a doctor, but there are certain ways that they can tell. And there's always lab testing that you can do. If the guy ejaculated and everything and got off, they can do swabs and look for DNA and everything else. So that's always a possibility.
The only thing that you've said to me this entire time that upset me was when you just said ejaculate. That's the grossest word. That's such a gross word.
Sorry.
And it's so
How
offensive.
else would you like me to say it?
Like, if you just were like, if the guy came inside of her, like, that would be normal to me. But even though that's a filthier word, but you said ejaculate.
I'll be less clinical next time.
Ugh, it's yucky.
I'll be less clinical. My bad.
Please, jeez. This is a lowbrow show. Let's not say disgusting words like ejaculate. But yeah, so in the movie, Brian Cox takes like one of those long Q-tips and he puts it inside of her, and he's like, she's all SpaghettiOs in there. Like, they're like, something horrible happened.
Yeah, they were saying that she had been like cut up on the inside and everything, and that seemed weird to me, but I also, like, I haven't had too many cases. I haven't been in too many cases like that at all. I've seen some pretty crazy stuff and people doing crazy stuff to each other. I haven't necessarily seen a whole bunch of genital mutilation, so I don't have much input
Genital
on
mutilation, that's the second grossest thing you said.
What? I'm sorry, I haven't seen a vagina all cut to shit. Like,
Yeah, I said it was full of SpaghettiOs, which makes a joke out of it. But like when you say it gross, then it just really is going to upset my audience.
Oh, I'm so sorry. I'm trying to be respectful. I'll stop being respectful.
Try to use food metaphors. That really helps. Like that really helps the medicine go down.
Sure. Yeah.
So let's see. So yeah, so then they decide, they're like, okay, now we got to go inside and do the inside check. And so he gets his little microphone and he's like, all right, we're about to, this is Dr. Graves and we're about to go on the inside check. And they cut her in a Y shape, which was super gross. Very Frankenstein-y. Is that how they really do it?
Yeah, it's called the Y incision, and it's the easiest way to open up your chest as well as your abdomen to see everything inside. And one thing they didn't do, it was really weird, he removed the rib cage, but he didn't do much. So when you make the Y incision, there's like a point from where your neck meets your chest and everything else. There's a point there from the Y incision. They didn't reflect that back at all, which was really weird because when he removed her chest plate, he removed it like a normal chest plate. But if they didn't reflect back the neck, you couldn't remove the rest of the chest plate. So I'm not sure how they actually really opened her up to like see her heart and everything if they didn't reflect everything back as much as they needed to. That was kind of odd. Like he could just reach his hand in there and yank it out or something.
That was one of the parts of the movie that was really gross. And like you had said, it was like the bone cracking noise. They didn't show the insides. They just showed him like kind of really trying hard. And then he pulled out like a rack of ribs. Like that was the chest plate?
Yeah, so that's what we refer to as the chest plate. It's usually from your clavicles down to your bottom ribs, and you have to remove that so you can see the heart and the lungs, and have easier access to the stomach and the liver, so the doctor can examine all those organs. You know what I noticed about this movie? It wasn't like over the top grotesque. Like they showed some really gross stuff.
Yeah.
I will give you that, but it's not super gory like I've seen other horror movies and other things. Like there wasn't, they did have it, it was weird. They did the Y incision and she had blood just pouring out.
Yeah.
The way the blood came out of her was weird.
Right.
But that also goes in with her storyline for the scary movie and everything. But it is true that people, like, you cut into someone and they can bleed a little bit. That is a true thing. Because you have to realize there are blood vessels and arteries and everything, capillaries all through your body. And you have to cut through some of those when you're reflecting the skin and everything else. So you're going to cut through some of those and some blood is going to come out. It's not pumping out, like the heart isn't still beating and pushing the blood out. It's just natural gravity kind of thing. So
all all that blood is still in there though. So does it just like sink to the back?
It depends on how they died, because that's where livor mortis comes in, if you've ever heard of anyone talk about that. So if they die on their back, it'll all the blood and a whole bunch of fluids and stuff will settle on their back, so that when you roll them over, their back will be red, or it'll be a different color than their natural skin. Okay. And a doctor always looks at that to see they're looking for the livor mortis, and there's a test you can do, which is if you put pressure on it and it blanches, which means it turns white. Mm-hmm. It means that the livor mortis it helps the doctor determine where in the stage of livor mortis it is, because it's the same as rigor mortis. It's the same idea of rigor mortis, where it sets in over a certain amount of time and then it kind of goes away. It doesn't completely go away, but it does have a kind of schedule of time of where if you can see a blanching, then it could be just starting or it could just be receding. Whereas if it doesn't go away, if it doesn't blanch, then it's still been there. It's been there for a while, and they're in the middle of the livor mortis process and everything else. So,
oh my goodness. I'll tell you, this is fascinating stuff. This is crazy. So
It is interesting stuff, and I don't mind answering questions about it, and I answer to the best of my ability. I always try to make sure people understand I'm not a doctor, so I know a lot of this stuff because I've worked with the doctors and I've studied some of it in school, but I'm not in any way a professional, like, with a degree in this specific thing. Like, I'm not a doctor, so I can't tell you exactly everything, and I might get some things a little bit wrong here and there. But I do know some stuff that I don't mind sharing at all.
Well, me and my audience appreciate all of this sharing. This is good stuff, except for when you said ejaculate. I really wish that, like, I can't get that out of my head. I can't. I know, but I can't. I can't unhear it.
No, it's already gone.
But see, now when you've been talking all professional, and then you said he came inside of her, that made me grossed out too, because I feel like that I made you say that.
Well, so I'm trying to be like respectful and trying not to freak out any people who are like, oh my God, what is she saying about that person? She's mistreating the people, the dead people. Like, no, I'm trying to be respectful. So it's usually easier to be more clinical and respectful.
I understand. And so I would like to say to my audience that if for 1 minute you think she's being disrespectful, it's me that's being disrespectful. She's just answering my questions about boners and boobies and dead stuff, okay? That should clear up anything. that. Yeah, that should clear up anything, anybody pointing a finger at you. That should take care of that. Okay, so you had mentioned they cut into her, they opened up the Y incision. Also, so was that the breast thing that he took out, or the bone? Was that like what they were talking about in Pulp Fiction, that they had to pierce through to get the needle into her heart to shoot her heart full of adrenaline?
So usually if you're trying to stab someone with adrenaline, you're trying to avoid going through the bone. Because that can cause a whole bunch of other problems, like you can dislodge pieces of bone, and that can be a whole issue. I knew someone in college who was deathly allergic to so many things in life, so she always carried an epinephrine pen on her because she never knew when a hidden ingredient was going to have her in anaphylactic shock. So one time she went to like a taco cart, and she thought it was like a completely okay with her diet taco. It turns out it had something like flour in it or something, and she was deathly allergic to that. So she started to have a reaction, and her boyfriend was there, but he had never actually given her a dose of epinephrine when she was in the middle of an attack. Like, she's gone through it with him before, so he could be ready and everything else, but he'd never had to do it in an actual attack. So when he did it, he stabbed her in the top of the leg, which is dangerous for stabbing epinephrine because the top of the leg has less muscle there. And that means it went to her bone and it nicked the bone a little bit. And that caused her to have some other health issues as well after the fact that she already went through an allergic reaction. And now she's having some additional health issues because the bone was nicked. So usually for an epinephrine injection, you try to avoid going through bone. So like if you're doing it in the leg, you do it in the side of the leg, in the medial part of the leg. If you're doing it in the chest, trying to do it directly into the heart. And again, I'm not a doctor, so I don't know the exact specifics of this, but you really, from what I would understand, you'd really want to avoid going through bone and hitting any bone stuff because that could cause other issues. You want to try to go in between ribs if you can.
Because everybody can look at a body and be like, okay, I'm going in between the ribs.
Right, like you really do have to be a medical professional for this. I was talking to one of my coworkers who actually used to be an EMT, and he was explaining some of the like emergency medicine that they do in the field and everything else, and where they place certain things. And like if they have to reinflate your lungs, if your lungs were deflated, they really have only specific places they can do it. And it's between certain ribs, and you got to know which ribs they are, and it's very specific so they don't cause further damage. So that's definitely one of the things that you want to be a medical professional to do. You don't want to just be like, I'm going to stab you in the heart with some adrenaline and it'll fix everything. Yeah, no, that's not a good idea.
So you wouldn't want John Travolta just stabbing you in the heart with some adrenaline?
Honestly, this might offend people. I'm not a big fan of John Travolta in general, so I don't really want him.
Yes. Fuck John Travolta. Fuck him right in his fucking dancy little patoot, because I don't like him either.
No, I'm not a big fan of his, and then him stabbing me in the heart, I'm gonna push him aside and be like, no, I might be dying right now, but someone else can handle this. No, thank you, John Travolta.
He is a Scientologist, though, so that pretty much makes him a doctor.
He must know everything, yeah.
So they open her up. Did you believe in the opening? Like, so you said like they don't normally show like the layers of fat.
Yeah.
But she didn't really have any fat on her, though. She was a pretty petite little thing.
No, but there's always a layer of fat. Like, even babies have it, even the skinniest people I know. It's not necessarily like a super thick layer. Like, obviously someone who hasn't been eating well and everything, taking care of themselves, they have a thicker layer of fat on their stomach or in other places. But everyone has a layer of fat. It's an anatomical thing. Like, it's part of the way your body insulates itself and keeps itself warm. So there's always some amount of fat somewhere. It doesn't mean that someone's overweight or anything. It just means that they have a normal anatomy. So the fact that every movie and TV show, they never show the layer fat, they never show the muscles too much, they just show this like red goo and skin peeling back is really weird to me. It's very inaccurate.
I did notice when they opened her up, it was pretty empty in there. There was a lot of extra space.
Yeah, that was kind of weird too. Your organs are specific to your body, and they take up the space they need in your body. But there shouldn't be a lot of extra space. If extra space has been created somewhere, that's usually a bad sign.
Okay, so they open up the body, and it looks like the inside of an operation game. And they start pulling things out. And I noticed they didn't have to cut anything out. They just kind of reached in and pulled it out.
Yeah, that was really weird. Like with the heart. Okay, so first of all, I meant to say this earlier. Going back to when they did the Y incision, he had a huge scalpel that he used. It was like a good 3 inches long or something. That's not, no, we don't, at least in the offices that I've worked in, we don't use 3-inch long blades to cut someone open. We use what we need for the job, which is a lot smaller. But no, yeah, they, like when they were removing the heart and stuff, they kind of just pulled and poked at stuff. And it was really weird because they started out the movie with a different autopsy too, and then they moved on to the Autopsy of Jane. And on both autopsies, they took little sections of organs and put it in individual tubes.
Right.
And I wasn't sure why they were doing that. That was really weird to me. The doctors will take individual sections of organs to possibly look at under a microscope and things like that. But like each individual organ section in its own little tube is not something that happens. That's
right.
Not realistic.
So did they pull the heart out and weigh it and then put it back in?
No, so what happens is the doctor, at least in the office I'm working currently, the doctor will remove the heart because they're looking for any kind of pulmonary embolism, which means a blood clot to the heart or something like that. So they want to make sure that doesn't happen in some people, or if it has happened, that's their cause of death and they need to know. But they usually do have to cut the heart out. You can't just like reach in and pull it out. It's a muscle. It's attached.
It doesn't deconnect like a Lego?
No, it just doesn't pop out there. So yeah, we'll weigh it and get an organ weight for the doctor, and then they'll take it to their cutting station and do a dissection of the heart and go through and look at all the arteries and valves and make sure everything's open like it should be, or if there's someone who has heart disease, they're looking at the heart disease they have. If there's someone who hasn't been eating well and taking care of themselves, there's always the plaque that builds up in the heart, and they can see that kind of stuff. So no, the doctors will actually like cut open the heart into pieces and look around at the anatomy of the heart and what's going on there.
So they don't just like put it up to their mouth and blow in it, and if it makes a good noise, then they know it's a good heart?
Not at all. No.
God dang it.
And nowhere of the realm of accurate. No one's putting anything in their mouth in the autopsy suite, food and drink, anything going into your mouth, not allowed.
I've seen that in Friday the 13th too. A dude was like eating a sandwich and he laid it on Jason's chest while he was like doing the autopsy.
Oh God, that's just gross on so many levels. Oh. Not going to happen in any respectable office.
What if like you like sneeze and your gum flies out of your mouth and goes inside the body?
So you're not supposed to have gum because like there's particles in the air and then they catch in the gum and then you're chewing that. That's just gross.
Right.
That's really disturbing. And also in the offices that I've worked in, we have masks over our faces to prevent us from getting possible diseases, like mainly tuberculosis. If someone had tuberculosis when they died, we don't want to catch it. So the mask over our mouth prevents that. If for some reason there's some kind of spatter of blood or whatever else from whatever we're doing, we don't want that getting in our mouth, obviously. We also have face shields protecting our face. So that was another thing I noticed with their autopsy. Like, they were at least decent enough to pull on actual, like, gowns over their clothes.
Right.
I've seen a lot. One of the shows that does it really badly is iZombie. I love the show. Don't get me wrong. I really do love the show. But she just, like, pulls on a lab coat and then starts cutting, and I'm like, no, you don't have any kind of protection. You have to have, like, a face protection. You have arm protection, so you don't want stuff to just touch your skin. Like, it's not terrible if it does, but you don't want it to necessarily just touch you and be all over you. Like, that's gross, and that's not sanitary, and that's not safe for the people working, so you don't just pull on a lab coat. You actually have, like, disposable, what we call personal protective equipment, PPE, that you pull on so you don't have to come into contact with as much stuff.
Right.
It's just really disturbing. So yeah, no, you're not gonna put anything to your mouth. You don't have an open mouth. You don't have anything in your mouth. No. And the fact that they weren't wearing face shields or any masks was really gross to me, because there's fluids in the body, there's blood, there's other things that just spray out sometimes.
Oh,
and
yeah.
what you do, it kind of flies around, and it happens where you get it on yourself. You don't want that on your face. It's not pleasant on your face.
We had white shirts when we worked security at the hospital, and so I always gowned up. I never went into a room where we were going to hold somebody down. And there was tons of times when I had a face shield on and got sprayed across the eyes with blood or piss or shit. So
yeah, we got to be careful. Same kind of stuff. So yeah, you want something covering somewhere, because you never know what's going to happen. We have medical residents who come in and watch, and they do a tour at the facility as part of their studying process and everything else. And every once in a while, they stand really, really close to the table, and I tell them, like, that's fine, but just so you know, you're in what we call the splash zone, where things are possibly gonna splash you. Like, we try to wash the table down as much as possible, and sometimes the water splashes off when we're cutting. Sometimes some people are bloodier than others, and the blood can kind of just fly as you're cutting. Like, it just happens. It's part of the process. And so I let them know, like, if you want to stand there, that's fine. Don't be surprised if you get something on you.
That's awesome that you have a splash zone like a Gallagher concert.
Yeah. Right.
So, when you're looking inside of a body, do you have to, like, reach in and grab the ribs and, like, yank them apart so that you can see all the stuff on the inside?
We do have to, like I said, we have to remove the chest plate, which is your ribs. That's the top part of your ribs. So we have to remove that, and it depends on what office you work in and how the doctors prefer it. I've worked in an office where they did use the cutters like he was using in the movie.
Those were like lock cutters. That's crazy.
So they're more like garden shears.
Yeah.
So that's a thing. And the office I currently work in, we use a saw, the same saw that we use for the skull. We saw the ribs off that way. And you have to remove that chest plate so you can get access to the organ. So once you remove that, you're not ripping apart any ribs. You're usually not ripping that apart too much either. You're just doing what you can to remove it, which usually isn't too difficult. Every once in a while it gets kind of stuck and you have to use the saw a little bit differently, but it's not like you're just ripping it and you hear the bones shatter and everything else. Like, it's not that violent.
Do people have baby back ribs?
So, I'm not sure how to answer that question because I'm not sure exactly what that means. Like, everyone has ribs. But there have been cases where we have to take sections of ribs for the doctors to study, like they're looking at past fractures or whatever else with the ribs itself. And we have to put those ones in a separate container so they can set, and then the doctor can look at them later. And every once in a while, someone will make a joke about baby back ribs. I mean, like I said, we got to keep the levity in the office so people don't get too depressed, but, you know.
So you guys sing it, right? You sing the song back there?
Some of them will. I just sigh and shake my head at them because I'm like, come on, guys. We can be cleverer than this. We can be better than that.
You guys are better than a Chili's commercial.
I want my baby back, baby back, baby back, baby back, baby back ribs. I want my baby back, baby back, baby back, baby back, baby back ribs.
Excuse me.
Chili baby back ribs.
So getting back into our conversation, let's talk about smells. So what do you use? Because, I mean, there is nothing, and I mean nothing, like the smell of a dead body.
No, it's definitely very specific, and I know there's a whole bunch of TV rumors and other people rumors about using like Vicks or other kind of topical treatments that you put under your nose and everything. Everyone that I've met who does this professionally and like this is their career path, whether they're an investigator or a doctor or a tech like I am, it's just something you deal with. It's not necessarily that you get used to it, and it's not necessarily something that doesn't bother you. It's just part of the workday. Like, oh, here's the bad smelling part of my day. This is really gross. Oh man, this smells really gross. I hope I get through this fast enough to move on to something that's less gross. Like,
right.
It's just another thing that you come to accept in this line of work, and you kind of just try to move on from it as best you can. And there are some days, every once in a while, it gets to me. We had a lady the other day who passed away of natural causes. But she had a whole bunch of poop in her pants. And oh my gosh, it was the worst smelling thing. According to one of my coworkers, she must have had C. diff or something like that, because it was obviously like an infection smelling kind of poop, and I almost threw up. And that was one of the few times I've almost thrown up in my job, because it just smelled so bad. And like I said, certain smells are worse than others, and you just learn to work through it and filter it out as best you can, because you just got to do the job.
Poop is bad, but I think vomit's worse.
I honestly, like, it really depends for me. Vomit is pretty bad, and we don't get too much, like, vomit in the same sense. There's what we call as purge, which is just a natural process of the body. Like, if you had something in your stomach or in your throat when you died, sometimes it comes back out your mouth. It's just gravity in the process. And that can smell sometimes. It's worse with live people, I think. Like, live people vomit is really gross to me. It's other things. My biggest thing, though, especially working in an autopsy suite, is anyone who's been in the hospital long enough and they have infection in their body still. Like someone who died of pneumonia or some kind of infection inside, and you have to open them up, you can just smell it. There's a whole bunch of fluids usually in their body, more so than normal, and you can just, it's an infection smell that is just really gross. You can just, it's almost like smelling the process of the body rotting worse than normal decomposition. It's gross. It's way worse.
Do you ever feel like you, like, bring that home with you?
Yeah. This last week we've had a lot of people who decomposed, and it's summertime, and especially where I live, a lot of people tend to, in the summertime, be found when they're decomposing. And there were quite a few days this week where I was like, okay, so I'm not stopping off at the store today because I smell really bad, and a shower is the first thing I'm going to do when I get home. Yep, that's going to happen.
Yeah.
And it's not like I have any of the stuff on me. Like, I didn't get splashed with decomposition fluid and just left it on me. That's gross.
Yeah.
I wash my hands as best I can at work, and I wash all the way up my arms if I can. We do have a shower. We do have showers in the locker rooms available at our work. I don't necessarily like the showers or the locker rooms, so I usually just prefer to clean up as best I can in the sink and then just take a shower when I get home. But yeah, it just kind of, it's, sometimes decomposition is just a smell that just kind of soaks in. Like, it kind of gets in your hair sometimes. Yeah. It soaks into your clothes sometimes. So we wear scrubs in the back, and they're provided by our office and everything. So they stay at the office, they get washed at the office. But that smell just kind of like soaks in, and you kind of smell it the rest of the day. It's not fun. And last week it definitely happened. I definitely came home and showered a lot in the afternoons. Not that I don't shower normally, but it was definitely right after work, I'm taking a shower first thing. Not stopping at the store, not stopping anywhere. I gotta take a shower.
I'm sure the public appreciates that.
Yeah, I'm sure they do.
Do you just getting done with a nasty one and you're like, you guys want Chili's for lunch? Let's go to Chili's, right? And you guys just all smell like death? I
do have friends that do that. Coworkers and such who don't really notice the smell. So they sometimes they'll get it on their scrubs, or it just has soaked into their scrubs, and they're like, hey, I'm going to go run to the gas station, or I'm going to go run here for a sandwich. Let's go. And you're like, dude, you need to change your scrubs first because they smell. And they're just like, no, it's okay. You can sometimes see people, like, I've gone to the grocery store before after I've worked a gross case, and I don't really smell it anymore, so I didn't notice. But you see people in the store, and they're just like, what is that smell? And you're just like, oh, man, I know, right? That just... oh, that stinks. I don't know what that is. So weird.
Do you ever just, blame it on somebody farting? You're like, ew, stinky.
No one's ever really said anything to me about it directly, but I know some people were joking around the other day, and they're like, oh man, whoever smelt it dealt it. I'm like, walked away at that point. So
you just kind of sink back. You're like, oh
right.
No,
it wasn't me. You smelled it first. I didn't do this. See you later.
That's horrible.
Yeah, it can be pretty gross. It's part of the job. It's part of the process of nature and everything else.
It probably doesn't help with dating, though.
I tell people where I work, and they're very interested by the stories. Uh-huh. I know stories from my coworkers and their significant others. Like, one of my coworkers, he's really bad. He'll get stuff on his scrubs, and he won't notice it, and he won't change, and he'll just smell. And then he'll go home afterwards, or he'll go to the gym, or he'll go see his girlfriend or whatever afterwards, and she's just like, babe, babe, you smell. And like my other coworkers have the thing with their significant others too, where they just get home and they're like, oh, you had a stinky one today, didn't you? Okay, so go shower. So I don't personally know that. I don't know anything. Like, I don't say it really affects my dating life because it never really gets to that point in my dating life, unfortunately. So, or fortunately, I don't know.
All right. Well, that's so you sort of have to like find somebody that has a dark personality. It's kind of like yours.
It definitely helps. I know a lot of the coworkers I work with, like their significant others, one of them, some of them work in a hospital setting or a veterinary setting or whatever else, or even sometimes in a medical examiner's office kind of thing. Like there are people, and it's just sometimes I know people who have people totally outside our field that just kind of accept it. They're more go with the flow kind of people, so they're just like, oh yeah, you smell, you should go take a shower, but it's not going to stop me from wanting to be in a relationship with you kind of thing. It definitely helps, but you know, it's not necessarily everything.
Okay, so now is the time in the show where we're going to get into spoiler territory, because we're at that point in the movie where stuff starts going down.
Yeah.
So for anybody who hasn't seen The Autopsy of Jane Doe, this is where you stop the podcast, go watch the movie, and then if you're interested, you come back and listen to it from here. Because this is the point where, spoiler alert, they open up her stomach and they find some weird shit in there.
That was totally weird the way they did that, by the way. So you couldn't really tell if they were opening the stomach or the intestines, first of all. And he just, like, cut in directly where stuff was. Like, he already knew that it was there.
Yeah.
So that was super weird to me. So when we do autopsies, we completely remove the organs from the body. So the doctor will remove the heart and lungs, checking for any kind of embolism or anything else that could be potentially wrong. And then usually they'll have, if they want to, they have a technician who will remove the rest of the organs, like me. And you completely take it out of the body. So you completely take the intestines out of the body, and the doctor can examine them if they want to. Every once in a while, a doctor will dissect an organ inside the body just to see where it is and what's going on when they dissect it, where it is. And that can happen with the intestines more often. But for the most part, you usually take the organs out before you just start cutting into it. So that was kind of weird. And the fact that he knew exactly where to cut into, because the stomach is attached to the intestines, and the intestines are miles of just, intestine. Like, there's just so much intestine there. You can't know exactly where to cut into.
When you pull the intestines out, do you pull them out like Pee Wee Herman and Pee Wee's Big Adventure with the chain? Are you like...
Just like... it depends on how you've been trained. Usually I'll kind of... it's not exactly like this. But it's not just like Pee Wee Herman, but it is just pulling it out in kind of like a rope form. Do
you wrap it around your other arm like a cord? No.
But you do just kind of like, you remove it, what we call in a block, as much as possible, so as much of it in a group as possible, but there are some parts of it where you kind of just have to snake it through and remove it in individual parts. So
you really got to dig in there.
Yeah, you do have to really get in there, and a lot of the autopsy is by feel, so it was really weird that he could just like cut into something and know something was there without feeling it there. Because I've gone through an autopsy and felt something like in their intestine or in their liver or something and been like, hey doctor, this doesn't feel right, maybe you want to check this out. And some of the case is done by feel. You got to know what feels more normal versus completely weird and everything else. And every once in a while I'll say, hey doctor, this is really weird, and they're like, oh no, that's completely normal. And I'm like, okay, I'm just stupid then. Move along with your day, pretend I didn't say that, Right. So you gotta, some of the autopsy is by sight, some of it's by feel. You just gotta know what you're working with. And the fact that he just cut in there and found this, I think the first thing they found was this scrap of fabric.
I can't remember if it was that or if it was the flower. I think it was the flower.
Oh, no, it was the flower. You're right, yeah. He just, like, cut in there and knew and saw the flower there.
What's amazing is he pulls the flower out, he goes directly to a book and flips right to the page.
Yeah.
It was just like a wet, dead flower.
And he knows how to analyze this flower. He has a book about flowers specifically, and this flower happened to be in that book specifically. Like, this was very, very catered, yes. Obviously. Like, that's not real. If you found something weird like that in someone's stomach, if the doctor wanted more testing, they'd send it to a lab. They're not going to be able to know just right on the spot what that is, unless they have some kind of flower hobby, they might have an idea or they've come across it before in a different case. But honestly, like, the fact that he didn't know what it was, pulled a book down, looked it up, and was like, boom, I got it.
Right.
That was weird.
So what's the weirdest thing you've ever found?
Man, that's a good question. I haven't found too many weird objects inside someone. Like, I haven't come across a whole bunch of people who eat weird things that they're not supposed to. A lot of people, and public service announcement to everyone listening here, chew your food. There's a lot of people who come into our office and there's like whole chunks of whatever in their stomach, and you're just like, how did they swallow that? How did that make it? Because you just get like huge chunks of whatever food in there, like whole slices of potato in their stomach. You're just like, how in the hell did that go down? There was one person that I did, I don't know, maybe like 6 months to a year ago or something, and she had some mental issues and everything else, and she actually ate rocks. And I found the rocks that she had eaten in her, like, I felt her stomach, and I was like, this is really weird, doctor. You need to look at this closely. When you get to the stomach, like, pay close attention, because something's going on here. And they went and looked at the stomach real fast, and they found the rocks that were in her stomach. It was disturbing. Yeah.
I had a patient one time, she didn't want to go to the psych ward, and they told her, like, you're crazy, you're going. So she went in the bathroom, and she had rings all over her fingers. And she took off all her rings and her necklace, and she swallowed it all. And the doctor...
How was that supposed to help her from going to the psych ward?
She thought that would prevent her from going. And their doctor's like, not only is that not going to prevent you from going, but we could surgically put you under and remove that, but I'm going to go ahead and let you pass it.
Now you're definitely going. Like, you just proved to us that you need to go somewhere with higher care.
Exactly.
And we could make you suffer for this. Or you just made yourself suffer. I know there's a whole bunch of stories, and I don't know how true they are. Like I said, I'm not a doctor, but people swallowing stuff and it can perforate your intestines and your stomach and everything else. So, like, taking the risk of swallowing a necklace, especially if it has sharp pointy bits, or a ring that has sharp pointy bits, like, it's a huge risk to take, my friend, because once it punctures your intestines, you start going septic, which sounds awful, and it is awful, and you just don't want to do it. Don't swallow weird things, people.
So whatever you swallow has to go through your whole hose, and then pops out in the big round tummy, yeah?
Yeah.
And then that's full of stomach acid?
Yes.
So you cut the tummy open, and you start pulling shit out of there?
The doctor will open up the stomach, and they'll usually cut it open, like, over the sink or something, so it falls out so they can see what was in the person's stomach. Because there are people who will obviously overdose on pills, and sometimes the pills won't fully digest before they get to us, and you'll still be able to see the remnants of the pills. There are people who choke on food, and that's how they pass away, usually older people, but not necessarily always. And you can see remnants of other food in their stomach, so you can say, well, obviously if they had food in their stomach, there is a good chance they might have choked on something, whether or not you see it in their throat or not. It's more likely. You could be like, okay, that's a plausible story, versus if they had absolutely nothing in their stomach and they're supposedly choking on something, you're like, that might not be entirely true. You know, you can't say for sure or not because you weren't there, but, you know, you can kind of lean into where you think is more likely and everything else, so...
Right. So the stomach acid, can you, like, stick your finger in it and go, ow, burn my finger?
So usually by this point, it's lost a lot of its acidity, because once you start to die, part of the chemical process, everything is starting to break down. So your stomach acid isn't as toxic anymore, especially if you had something in your stomach that kind of balances out because the thing about stomach acid is it's super, super acidic. It's pretty much hydrogen chloride, HCl, in your stomach. Obviously, that's one of the strongest acids out there. If you were to just touch that with your finger, you get severe acid burns.
Really?
But once it's in your stomach itself has special linings to prevent it from just, like, rotting out your whole body.
Right.
And then once you've passed away, a lot of that acidity and toxicity of everything kind of dies down, and everything else just naturally part of the body system. And the food balances it out, of course, and everything else. So it's less acidic, and it's not dangerous, really. It can still be somewhat dangerous, but it's not necessarily as dangerous as just sticking your finger into hydrochloric acid.
Right. So in the movie, they look into the stomach and they find the cloth with a tooth wrapped in it.
Yeah.
And he's like, Doc, we've got something weird here. And they open it up. Could a cloth survive being in stomach acid?
So they talked about in the movie, they were listing off, like, first of all, she had her extremities broken, and then this happened, and then this happened, and then this happened. That part was really weird to me, because you can't necessarily say what happened first. There are certain things that a doctor could look at and be like, oh yeah, this happened, and then this probably happened next. But you can't say definitively this, then exactly this. So it depends on when in the process they forced that into her stomach. There is a possibility that if they did it like right before she died or right after she died, that it could still survive the stomach. It always depends on the individual person too, with their body chemistry and everything else. Depends what the fabric was made of, everything else. So there's a lot of factors that could contribute to if that survived in her stomach.
This was definitely not modern fabric. It was very old and very like woven looking.
Right, and actually the interesting thing about older fabrics is they have more of a tolerance, actually, to wear and tear. So, like, what we wear nowadays is more prone to damage because you go out and you buy more if you damage it. Whereas in the olden days, it was like, I only have money for this one toga. I'm not going to damage it. It's going to be good, solid toga. Like, quality over quantity back then kind of thing.
Right. So don't you dare get ejaculant on my toga.
Fabrics like that back in olden days were made to last longer, and it looked to me, in my non-expert opinion, that this fabric was one of those more older things that was made to last. Like, it wasn't easily gonna fall apart. So
well, they flat out looked at it, and it still had like pictures and writing on it and stuff. It was really well intact.
Really well preserved. I don't know if that's possible or not. I live in more modern times and I haven't seen something like that, so I don't know from any kind of personal experience. I would theorize that it's possible. There's a lot of things that are crazy but possible, so.
So we also skipped over when they opened her up, like her lungs were all burnt on the inside and she had like scar tissue all over her organs and stuff.
Yeah.
They didn't explain that very much. They kind of tried to.
Yeah, it didn't make sense to me either. Even what they tried to explain, they almost made it sound like someone was scratching her organs internally, but I didn't understand how that could be possible. And then the whole burn look, like, they were black lungs, which, like, first time I see them, I think, oh, smoker's lungs, because they look like smoker's lungs.
Right.
Any of you that smoke out there, your lungs turn black and it's really gross. I suggest stopping. I'm not going to tell you have to, but I'm going to suggest it. It looked like a smoker's lung, so I wonder if, like, for that look, they were trying to think, like, oh, they made her inhale, like, a whole bunch of burning smoke and maybe even shoved something burning into her mouth or something. I don't know, because they didn't really explain what happened with the burn look on her lungs. They didn't really explain the scarring. Scarring can happen on your internal organs from, like, if you have to do certain surgical procedures, it'll leave behind scarring. If you have certain diseases, it can leave behind scarring. So it kind of depends on what happened to you in life and everything else. But the way they described it, it didn't make sense to me. That didn't seem very realistic to me at all. They were talking about some kind of cult doing a ritual on her to give her these scars. I'm not sure how they would have given her those scars in a ritual. That doesn't make sense to me at all.
Well, this is when the movie goes from an autopsy film to completely batshit crazy. And the lights go out and the whole thing like turns in, like, the whole place is like in an earthquake. And then when the lights come back on, the dead bodies, there were 3 other dead bodies in those storage cabinets that aren't even real apparently. And and they are gone, and so there are dead people up walking around. And one of them kicks the ever-living shit out of the older guy, Brian Cox.
Yeah, we never even see who it was, though. That was really creepy.
Yeah.
And the most I saw was, like, the flashes of the burn guy that you saw at the beginning, and then this random chick who, it was super weird. She had her mouth and her eyes stitched shut.
Yeah.
That is not a thing you do at the coroner's office, and it's not the same procedure at a funeral home. I don't work in a funeral home. I have not worked in a funeral home, so I don't know the exact process. But from what I understand, they're not going to do it externally. So they're not going to sew your mouth on the outside. So when your family is viewing you at your funeral, you see the stitches.
Right.
Because that's traumatic to the families. So that makes me wonder, like, what the hell happened to that lady? Because it could have been someone else, like, kidnapped her and sewed her mouth and eyes shut or whatever else happened. So
Right.
that was interesting. That's definitely not normal for a funeral home or an autopsy, as far as I know.
And I think that was basically just set up for the scene that we see later when she looks through the little hole in the door and, like, goes, rah, and you see the stitches stretch and everything, yeah. But the missed opportunity was that they established that guy got his face blown off earlier, and you can even see where the sheet kind of went in, where his face was, like, concaved, and then they didn't show him being all gross and creepy later.
No, that's part of the whole, like, they showed some gross stuff, but they didn't show necessarily as much gore as I would have expected in this movie.
Right.
Like, also, a little bit later on, the dad accidentally puts an axe in the son's girlfriend, but you don't, like, see him put the axe, you don't watch the axe go into her, you see him, like, kind of throw it, and then you see her bleeding out. You don't even see them, like, pull the axe out or anything else.
Right.
You just see her bleeding out, and you don't even see that much blood. So that was interesting for a horror movie to me, that it's not actually that gory. And I wonder if they thought maybe the autopsy part was going to be gory enough that they wanted to censor themselves around everything else. But yeah, that guy's face would have been a perfect opportunity.
Yeah.
It might have been hard to create, so I wonder if maybe that comes in with the budgeting issues.
It could have been, but they had the fully burned guy, which was pretty good.
Yeah. Yeah, that could have been really, really crazy and scary for a lot of people to see. So that's definitely a missed opportunity. I agree.
He had, like, one kind of floaty eye, and that really upset me. It's always the little details that fuck with me. And the burned guy had, like, one eye kind of floating up to the top of his head, and I was like, ah!
I don't want to see that.
I can't handle that. Ah! But yeah, so they try to escape. They realize, like, oh shit, something weird is going on here, and they try to escape. And of course the elevator doesn't work, so they can't get out of the basement. And there's some sort of, like, cellar door, and a tree has fallen on it, which is a sycamore tree. They make sure that they know that the father, maybe that's how he knew the flower, because
he's just a plant expert or something.
He's a real fucking plant guy.
Man, there were a lot of, like, convenient things that happened so they couldn't get out. Like, the tree conveniently fell on the door and everything else. And, like, the elevator makes a little bit more sense to me because they were saying that Jane Doe was a witch that was possessing things. So that makes more sense to me if you're thinking of, like, she could control electricity and everything else.
But who the fuck doesn't have stairs?
They did, though, but they only had the one set of stairs, which was really weird. And the one set of stairs didn't go up to the rest of the building. It specifically went to that door.
Right.
Like, I don't know what fire codes they just skated through or whatever, but I don't think that's actually legal. Like, having a rusty elevator and the one set of stairs. This is just a horror movie in the making. Like, if I were to walk into this building, I'd look over and be like, okay, so I'm not staying here after dark because that's going to screw me over and that's going to screw me over. I'm definitely dying here if I'm stuck here after dark.
For sure. So yeah, so they have no escape. So then they wind up going back into the autopsy room because first the dad thinks that the monsters are going to get him in the elevator, and so he swings the axe and hits the son's girlfriend, who he had told to come back for him later.
Okay, my question is, how in the hell did she get in, first of all?
That's what I was thinking.
So she was told to come back, but how did she get in? And how is she just walking around the building and not, like, calling out names? She's just, like, sneaking around, and so they didn't know it was her, so they attacked her. Like, I don't blame the dad at all, because he was being followed by possessed bodies. Exactly. And then all of a sudden this live person comes in who never made any noise or any kind of indication that she was there. Like, this is your own fault, chick.
It's absolutely, even if nothing weird had happened that night, if she was just sneaking around in the autopsy office, she deserves a fucking axe to the dome. Like, that's what you get.
Like, you announce yourself. First of all, how in the fuck did you get in? Because they need to fix how you got in, because that's an issue. That's a serious security issue. And second of all, like, what person who doesn't work in an autopsy facility is just okay with walking around and isn't calling out, like, hello, is there someone else here so I'm not scared as fuck and walking around by myself? And how did she not see the random bodies walking around and everything else? Like, she just is kind of there and getting hacked to death by the boy's dad, which I don't blame him. I would have hacked whatever to death too.
Exactly. Yeah, she deserved to die no matter what, so That was her own fault. She was a sick bitch anyway, though, because when she goes to look at the bodies in the beginning, she's like, oh, I want to see the one with the shot up face. And she's going to pull the sheet, and then the dad rings the bell, and she shits herself and doesn't look at it. But there was something wrong with her.
She was super odd.
Yeah, she was dating that boy because she wanted to see dead bodies, not because she liked his personality.
Right? Exactly. They said something, too. There's something in their conversation that just made me think, like, you're an odd date. I think it was like she was like, I'm never going to forgive you for this. And he's like, oh, come on. What if I bought you popcorn and Sour Patch Kids? Will that get me laid tonight?
Yeah.
I'll think about it. Like, what?
Yeah, she was like, who's gonna think it's funny when you're not getting pussy tonight? And then you're like, wait, what? And then he says, I'll buy you popcorn and Sour Patch Kids. Like, first off, yuck, what a pig. and then that's gonna get you laid. Like, I don't want to kiss a girl who's eating popcorn and Sour Patch Kids. Like, she's gonna have fugly breath.
I feel like that just made her, like, super easy, too. Like, she didn't make him work for it at all. Like,
no.
Nah, yeah, okay, all you have to do is buy me a few things and we're good. You can come on in. Doors open.
Absolutely, yeah. Yeah.
I'm not saying you have to make it impossible, but play a little bit hard to get. That makes it a little bit more fun. Come on.
You know how you can tell she was a skank? Is because she was wearing a jean skirt. No self-respecting woman wears a jean skirt.
Not after adulthood. You know what else I was wondering? How old is she and her boyfriend, the son of the guy? So the doctor, the coroner, whatever he is, he obviously has some kind of education or something. And he said at one point that his son was a medical technician, which is really weird because that's a very general title. But they never said, like, how old the son was and the girlfriend was, right. Which makes me wonder, like, were they still in high school? Were they in college? If they're still in high school, there's a lot of moral issues there, because in a lot of offices that I know of, you have to be at least 18 to go into an autopsy facility, to walk into the doors of the facility,
right.
Because there's just a lot of stuff that you shouldn't see unless you're an adult.
Right.
Not that you're gonna see a whole lot of stuff just walking down the hallway, but it's more of just like, and in case whatever kind of crazy stuff could ever happen, we don't want to cause an episode by some mistake. So you have to be at least 18 unless you have very, very special permission everywhere. So how old were they?
I don't know. I didn't get a sense for that either.
I don't know. They almost seemed like they could have been in high school because they seemed super immature and everything else.
Right. But then, but she was saying, like, well, you're going to tell him that we're going to move away together, right? And he's like, well, I haven't told him yet, but I'm gonna. And
I was sitting there, I was like, okay, so are you moving away for college? Are you just moving away? You're grown up enough to just move out? I don't know what's going on with you, dude. I don't feel comfortable with you being your dad's assistant. First of all, father-son coroner system is weird. That's just weird.
Yeah.
It's not a normal thing that I know of. And then second of all, you're just there, like, I don't know. It was weird. It was a whole weird situation there.
So they murdered his girlfriend. He was upset for like a second, and then he was like, all right, I'm over it.
It wasn't your fault. You didn't have a choice. You didn't know what was going on. We're moving on now.
Yeah, he's like, it's fine, Dad. And then they go back in, and then they start looking at her again, and their idea is, oh, fuck, she's a witch, which they jumped to that conclusion, like, right away. The weirdest thing, to get to that conclusion, they opened her brain, because they're like, okay, we got to finish the autopsy to know what's going on. Yeah.
And the only way we're going to figure out what's happening is if we finish the autopsy. Okay, sure, kind of plausible, whatever. They go straight to her brain. They don't finish the rest of the internal organs, which I'm wondering, like, what else is going on with those other internal organs? You missed the spleen, you missed the kidneys, what else is going on, man? They went straight to the brain, and they opened up the skull in a kind of weird way, so they had very limited access to the brain. And all they did was take out this one little chunk, and then they were done with it. They closed up her head again and moved on. They didn't even take the brain out and weigh it or do anything else to it. They just took out this little chunk and immediately threw it under a microscope, which I was like, what in the hell? That's not going to show you anything. Looking at a chunk of something under a microscope is only going to magnify the outside of that. It's not going to show you the inside. And they like made a whole thing of showing, like, oh, look, here's inside her brain and blood is flowing and everything else. And it's like, You wouldn't be able to see that. That's impossible. What are you doing there? And then the fact that they took a chunk of brain out, and then the blood is still flowing and pumping in this chunk of brain that's severed from the rest of her. Okay, sure. That's a very far stretch, but this is a whole, like, she's possessed thing, so sure.
I totally bought it. But I thought it was weird.
By this movie, I was not scared at all by this movie. But
by this point, I was shivering and pissing my pants. That's how scared I was at this point of the movie.
I was laughing so hard every time they did something because I was like, "Well, that was stupid. Why'd you do that? Why'd you corner yourself in the elevator?" Oh my gosh! Before they got back into the autopsy suite, also, we forgot about this. They had to go through a whole thing of smoke because the crematory got turned on, and all of a sudden the hallway is full of smoke. And then just as suddenly as the hallway is full of smoke, it, like, disappears so he can get his dad out of there and into the autopsy suite. Like, none of that made any sense to me.
Right. Well, we forgot to talk about the fact that the cat died in the vent. Yeah. And I don't know what the fuck happened.
I think so. They made it seem like the vents, the air system was never on because the cat crawled through. Because they showed earlier in the movie that the cat crawled out into the autopsy suite, which also really weird having a pet in the autopsy suite. But they showed, like, an open vent that the cat crawled out of in the autopsy suite. So that gave me the idea that, okay, they don't ever use that cooling or heating system or whatever because the cat crawls around in there. So I think what happened was that the cat had crawled in there and was moving around, and then Jane Doe turned on the AC, because then you see when he's down in that basement, you see the little, like, fan moving, you see the on the grate, you see the stuff moving on the grate, and then you hear the weird thunk noises and everything else, and I think that was the cat hitting the fan. Like, not the shit hitting the fan, the cat hit the fan, and it all went to shit from there.
It did. So then they throw the cat in the crematorium, which you probably shouldn't throw a pet.
The dad just, like, snaps the cat's neck. Like, he doesn't even think, like, let's take it to a vet or try to save the cat. It's just immediately, I gotta put the cat out of its misery. Snap. Oh, that was terrible. But yeah, I just, that whole scene with the cat was weird. And then they threw it into the crematory, turned it on, threw the cat in there, and started burning their pet cat.
Right, and they pull ashes out of that, don't they? So they probably shouldn't mix cat ashes with people ashes.
Yeah, you actually have to, it depends on which state you're in and everything else, but you have to have special licensing to cremate pets and cremate humans, and as far as I understand, I could be wrong, but from what I understand, you don't do it in the same thing. Because, like you said, yeah, you're pulling people's ashes out of there, and you don't ever cremate, like, more than certain, you don't cremate, like, 2 people at a time, because you want to collect the ashes.
Right.
But, yeah, you don't want to, like, you can't collect every single piece of ash, so the next time he threw a body in there, they're gonna have some cat ashes mixed in with them. A cat they didn't even know. It's all kinds of messed up.
What if your grandma was allergic to cats and then she had cat in her ash?
Right, and then she's just going through the afterlife like, oh man, now I'm stuck with this cat. That's really gotta suck, man.
Seriously, what if you're in, like, heaven, but you got, like, a cat sticking out of your arm because they mixed the ashes?
What happened to you? They cremated me some weird fucking way, man, and I'm not happy about it. I don't know. I mean, someone could be wandering around in the afterlife, whether they're in heaven or hell or whatever you believe the afterlife to be, and they just have this cat following them around or, like, literally attached to them. Oh, man.
So, back to when they're dealing with Jane Doe, when they go to open her brain, it looks kind of like they just unbutton the back of her head and fold her hair over.
So they kind of showed it, and they were actually kind of accurate here. He did take that really long knife that they started the Y incision with, and he went around her head. He did it really easily. Like, it's never just you slice around the head really fast and just peel her scalp back.
Right.
So you do have to do a cut similar to what he did, and then we call it reflecting, technical terms and everything else. You're reflecting the scalp back. But your scalp is pretty attached to your skull, and some people more so than others. It's a natural thing. It's supposed to be attached. So it can be easier or harder depending on the person, and he just, like, pulls it back like it's nothing, like just pushing a blanket back on the bed or something, like, oh, here we go, there we are. So that was odd. That was
so they do, though? That's real, that they, like, open the back of your head and then pull it forward?
Yeah, so you try to do... You try to do a cut that's far enough back so that if they are having a funeral viewing, the funeral home will make them look as presentable as possible. And when you have that cut back there, it's easier to hide because they're like lying on a pillow, so you're not really looking in that area for a cut on their head.
Right.
And funeral homes, as far as I know, try, because their reputation is staked on it, do the best job they can at putting the person back together so you don't see any of that. So even if like the pillow shifted or something, you shouldn't be able to see the cut that we make there on the head. But yeah, you do have to make a cut, usually behind the ears and then around to the other side.
So what happens if like you can't get the head back on right, so there's a big wrinkle in their forehead?
So usually what you do is you reflect the scalp and you have to saw into the skull, because you do have to get into the brain, and the way to get into the brain is sawing through the skull. We call that the skull cap, and you usually put that back in place and you sew the head tight enough that it shouldn't move around too much. But that is another thing that the funeral homes take care of, and I don't know their processes, but they'll go through and they'll secure the skull cap on there and they'll secure the scalp in place so you shouldn't get too many big wrinkles on your forehead.
Do you ever put the skull cap on your own head and like run around and be like, look at me, I'm a skeleton?
No, because I'm not weird. I also don't want dead person in my hair or on my head. That's just disturbing.
So when you cut through a skull, I've seen this like in Hannibal. Like they cut the guy, like Ray Liotta's whole head. They cut through his head and like just remove the skull cap. But like, how do you not cut the brain when you're cutting through the skull?
So you have to be really, really skilled with the saw to do that. I've been doing this for about 4 years now, and I still cut into the brain a little bit. And there's some damage, like as you're going through a regular autopsy, there is some damage that happens that you just let the doctor know, like, hey, my blade slipped and I kind of cut into this, or I wasn't expecting this to be exactly right here, so I cut into it. And one of the things they're expecting to see when you saw off the skull cap is some marks from the saw going into the brain, because every person's skull is different. Mm-hmm. We were talking about that one lady with the really thick skull that I encountered. Hers was really hard to tell. Usually it's a feeling kind of thing. When you're taking the saw around their head, you can kind of feel where the skull ends. There's like a little bit of a give. There's a different feeling to it. So you try to not go too deep into that, and you try to back off once you feel that little pocket there. But with that lady who had the 2 centimeter thick skull, the helmet for a skull, I just had to keep going. Like, I was like, I'm really sorry, doctor, this brain might be cut into more than normal, but I can't tell, and I can't get through the skull enough without going into the brain. I can't pull the skull cap off without going into the brain. There are some people, and every once in a while I'm really good about it. I try to practice it as much as I can. It's not always easy, but you can go through and you go around the skull and just hit that nice little pocket and not hit the brain. Uh-huh. But it also depends on the person. Like, some people have brain swelling to the point where even though you're doing your best to not push into the brain and everything else, you still go into the brain a little bit because their brain is just swollen so much it's sitting right against the skull. So there are things that the doctor expects to see and certain cuts that they'll see and be like, oh no, I know this was so-and-so. I'm expecting something more drastic if whatever I'm looking for is there, you know?
Are there people that are just bad at their job, like, that are, like, have your job that are just like, whoops, and, like, cut, like, a big old chunk of brain off, or?
You know, I don't know anyone personally, and I'm not going to go bad-mouthing people, especially because I'd like to keep my job. I have seen things where you're just like, oh man, that person should probably just stop doing that right now, because whatever they're doing is not good. It depends. Like, every once in a while I'll make mistakes too, and I'll cut into something or I'll cut something off and I'll be like, doctor, I'm really sorry. Here's this part for you. I tried my best. And as long as you don't make it a habit, it's really not that big of an issue, because the doctor can still see what they need to see and they take that into account. Where you get into trouble is you do stuff like that. So one of the things you have to do in an autopsy is you have to look at the neck organs. So there's... we call them neck organs. They're not necessarily organs in your neck. There's the thyroid, and if you're young enough, there's the thymus in your neck and everything else. So we have to remove the neck for the doctor to look at. And sometimes that involves removing the tongue with the rest of the neck, and sometimes it's just removing from the hyoid bone, hyoid bone down. But the doctor is going to look at everything in the neck, and every once in a while, it's a delicate balance when you're going and removing the neck, because you're right up against the skin, and you don't want to poke through the skin. Right. And sometimes it happens, and we call that buttonholing, because it creates this just like perfect little hole. And that happens. Like, you try to get really, really good so it doesn't happen ever. But every once in a while, just being human, it happens, and you just say, hey, doctor, I did this. I'm really, really sorry. Usually the funeral homes are good enough that they can find a way to fix it with, like, glue or some other thing, or they cover it up if they can get the family to request, like, a high neck kind of thing, whatever. So there are ways to kind of hide it from the family so they don't have to see that on their loved one when they pass away. But it's a kind of hazard of the job. It happens every once in a while. But the biggest thing is you always want to let the doctor know, like, hey, I messed up.
Right.
Because honestly, they're not going to care that you messed up too much unless you're making a habit of it. It's worse if you try to cover it up and they come back later and they're like, what the fuck was this? And you're like, oh, yeah, so,
That would be a good time to have some gum, because you could take the gum out and just put it over the buttonhole.
Yeah, gross. It's still nasty. And you gotta be careful with, how do you get flesh-colored gum? Like, where are you getting flesh-colored gum? I don't know about you, but most gum I've seen is, like, white or green or sometimes orange.
I don't know. I've never thought about it, but now I'm gonna look for flesh-colored gum.
You're gonna let me know when you find some?
Mm-hmm. You're gonna be the first person I call. I'll be sending you text pictures.
Oh my
God. Found the perfect thing for you to fix your buttonholes.
Jason, I'm gonna need you to chew this and hold on to it for me. No thanks.
Have you ever been, like, working on somebody and you just accidentally, like, cut their poo sack and just shot poo everywhere?
I've tried not to. There are some people, so it's part of your intestines, right? It's your colon and your intestines. And there are some people that are just, like, so backed up that no matter what you do, it's just gonna come out at some point. And there are some people that their intestines are just so fragile. They're either decomposing at this point, or there's something else with their intestines that they just tear open as you're removing them, and you just get poo in places. There have been unfortunate cases with people who are just, like, so backed up, they do just have so much poop inside them.
Oh my gosh. So if you get poo, like, all spilled out in the body, do you have, like, a poo vacuum that you can suck it out with? Like the dentist has, and they like, put it in your mouth, they're like, okay, right. Clamp down.
So it depends on if it's liquid poo or if it's solid poo.
If it's solid poo, do you just reach in and grab it and just throw it?
Pretty much. Like, you're in gloves, so the easiest thing is to just, like, scoop it up and throw it in the gross tissue bucket. Like, that's the easiest way to do it. So if it's solid, you kind of just gotta scoop it out yourself. If it's liquid, we do have a hose that we can use to suck out, like, sometimes people who pass away, they have a lot of blood, or, like, when you've removed all the organs, they have a lot of blood sitting in their cavity, but the doctor needs to see in the cavity to see if there's any rib fractures or anything else, so we have to get the blood out. Well, in some offices, you have a sink set up where you can suction out the blood through the sink and everything else. In other offices, you ladle it out and everything else like that.
Ladle? You have a ladle?
Yeah.
Do you call it a ladle?
Yeah.
Oh, man, I was going to ask you that with the shears, like the garden shears. Do you call them something fancy, or are they just big-ass shears?
We call them rib cutters. They have, like, super fancy ones that you can buy from medical stores and everything else that are specifically called rib shears. And I'm sure they have some kind of design that makes them very specific for cutting ribs. I actually have a tattoo on my thigh, and it's of the tools that we use in autopsy. And one of the pictures is a head saw, one of them is a scalpel and a blade, and the other is the rib shears.
Your lucky future husband.
I have been told that my tattoo is awesome, thank you very much. But we call them rib shears, but they're basically garden shears.
Yikes.
Yeah.
I bet they say Walmart on the side.
I mean, it depends on the funding that your office has. It really, really sucks, but it comes down to that sometimes.
Oh, shit. So, in the movie at this point, they realize that they're dealing with a witch and that she has possessed the other bodies. And I can't remember what her end game was. They said that she wants to punish us, but like, what the fuck? The autopsy guys didn't do anything wrong.
So it was something like she had to punish anyone who did anything to her. So I don't understand how it relates back to the first house she was found in either, because as far as I could tell, she was just buried under their house, and they didn't do anything to her.
Right. I felt like they probably, like, were... Like, they were doing some nefarious things in that house. They found her body under there, and then that's when she started, like, fucking them up, and she, like, made them kill each other.
That could be possible. That makes more sense. They really didn't explain that, so that could be a total answer to that. But the dad made it sound like anything that someone did to her, she was trying to do back to them. So she was the one who was somehow beating him up so much, and he had all those bruises and everything else, and he was already having, like, severe internal bleeding by this point in the movie. Like, if he didn't get to a hospital soon, he was going to bleed out internally, and he was going to die. So he made it sound like anything that was done to her, she had to do back to people, and the way to get, like, the curse lifted or whatever was on her was to fully let someone else experience what was done to her.
Right.
Is what I understood from it. So, like, he made the self-sacrifice and tried to whisper to her, like, take me, not my son. Right. Do it to me, not my son. And then, for whatever reason, he tells his son to stab him.
Yeah.
Which negates the whole curse thing. Like, you obviously have to suffer through everything she did, but now you've gotten stabbed, so you're not going to suffer anymore, so sorry.
Right. So he stabs his father and kills him, and then he's like... Then the cops show up to, like, get him out of there. And so he's, like, running... But it was
actually the cops.
Right, yeah. But he's, like, running to the door to, like, let the cops in. And I'm thinking, you look like you've murdered your girlfriend and your father.
Exactly. So, first of all, you have all these bodies roaming around the morgue.
Right.
Second of all, your dad is dead and your girlfriend is dead and you have a shit ton of blood on you, dude. What the hell happened? Why are you just opening the doors to the police? Why is your first thing... I'm going to let them in and be saved. Like, no.
Right.
No, you're definitely going to jail.
And it was, I thought it was very creepy. Like, he's, like, trying to open up the cellar doors, and the cop is like, come on, open the doors. And they're like, we moved the tree. You should be able to open the door. And he's like, I can't open the door. And then the cop starts singing the song that was on the radio.
Uh-huh.
That made my nipples hard, and I got chill bumps.
Okay, so that one is actually pretty creepy to me, too, because it's, like, what creeps me out, doing the job I do, I'm not too, like, freaked out about zombies, anything like that. What creeps me out is, like, possessions and, like, ghost spirits and stuff, because honestly, like, I don't know if ghosts are a thing or not, and I'm not going to risk it by pissing one of them off.
Right.
So, the fact that someone else could be haunting a building, totally plausible to me, because I don't freaking know. I have no way to prove whether or not there's a ghost there, and if they have the energy to move stuff around or do whatever. So the fact that he thinks he's talking to someone on the outside, and the cop's like, just let us in, son, just open the door, son, and then he starts singing the song that his dad used to sing to his mom, and the song that was on the radio and everything else too, like, okay, that was fucking scary, because your dad's supposed to be dead now, and everything's supposed to be done with. Right. That's fucking creepy.
Yeah, that creeped me out for sure. And then he runs to another place to try to, like, escape. And then he's at the top of a spiral staircase, which was super weird. Because where did that staircase go to?
So that's the staircase that goes to that door, that cellar door, and it looks like there's actually, like, a ledge that you could walk around on more, so maybe there's, like, something else up there, another level or something he could get to, because you're right, he, like, turned to run away, but he didn't go back down the spiral staircase, he just went further along the railing somewhere, so I don't know where exactly that was in the building, but yeah.
And so then he turns around and his dead dad is standing there, and it freaks him out so bad that he falls backwards through the railing and then falls to his death.
Which, I'm sorry, that was like a one-story fall, unless he fell directly on a specific spot on his head and it just, like, annihilated his brain. That's not going to kill you. I'm sorry, that's not going to kill you.
No, it didn't look like it was far enough to kill him.
That was the second time that day, too, like, totally off topic, but I'm a total nerd, Marvel nerd, and I was watching Agents of S.H.I.E.L.D.
Yeah.
Yesterday, too, there was a new episode, and one of the characters was made to jump off this, like, second or third story landing thing and died. And I was like, second or third story is not going to kill you unless you land really, really specifically on your head in just the right way. Like, it's very unlikely that that's going to kill you. So to watch that happen 2 times in one day, I'm just in there like, man, Hollywood is full of BS. Like,
what makes me crazy is, like, you always see characters or people getting stabbed in movies, and no matter where they get stabbed, they just, like, they die.
Right, and sometimes they, like, bleed out and die, which is a little bit more believable, but a lot of the ones I see, they're getting, like, stabbed in the abdomen region, and I'm, like, so many questions are going through my head of, like, okay, so when they got stabbed in the abdomen, did it hit their intestines and that's why they're dying? Because they're going septic and just getting really gross inside and dying? Or is it just blood loss? Because this is going to take a while for it to be just blood loss. And if they're going septic, it's also going to take a while. It takes usually, it's definitely an estimate, but it takes like 10 minutes for you to start dying from going septic and everything else. And blood loss from your stomach is going to be a little bit harder. But, you know, I've seen some crazy things. One of the cases we've had in the past few months, there was a guy, and I don't remember the full details about the case and everything else, but he had gotten in a fight with someone, and he came into our facility because they were like, we're not entirely sure how he died. We just know he was in a fight with someone, and now he's dead. So we're looking at him and going like, it doesn't really look like anything happened to him. He's not super bruised. He doesn't have any major cuts anywhere or anything. And then the doctor looks at his ankle, and there's this really teeny tiny little spot on his ankle that he had gotten cut. Well, it turns out the doctor pulled up some pictures of the veins and the arteries in the leg and everything else, and he's like, I think I know what happened. And he kind of looked at the leg more and reflected everything back and looked at it more thoroughly. And it looked like it had been just a lucky stab into the right vein, into like the... I want to say it was like the tibial vein or something, and the guy bled out.
It was his Achilles heel.
Thick, teeny tiny little stab wound on his ankle.
That's crazy.
And he bled out and died. Like, so I guess it's more plausible, but like, yeah, Hollywood, people getting stabbed in the abdomen and dying like that is not believable to me.
It drives me crazy when I see that.
Yeah.
I've seen people stabbed in the heart. They're even like, well, they got him in the heart. I've seen a knife pumping up and down with a guy's heartbeat.
Right. Because as long as something's, like, preventing the blood from just pouring out, then, like, the knife is still there. It's kind of just blocking everything. So, the person can still live. I've seen crazy stuff.
Whenever you see a guy pull a knife out, too, I'm like, oh, that was holding everything in, you idiot.
Yeah, don't pull it out. Unless you're prepared with a lot of pressure and whatever else, don't pull it out. Bad plan.
Bad stuff. So the movie ends. I don't know if you picked up on this weirdness, but she winds up, the cops come in and they don't know what happened. It's all a mystery, and they send her to another facility.
Which was super weird.
It was super weird. But did you catch the ambulance guy said something about, like, don't worry, baby, this is a one-time thing?
No, I didn't catch that. I, like, heard him talking to his girlfriend, and I thought he said something like, yeah, no, I'll just take care of this real fast and I'll be done. Can I just say, by the way, so they brought Jane Doe into the first facility in a body bag. And then they're taking her out of said facility, and she's only covered with a sheet on a cot. Like, why isn't she back in her body bag? Why is she just there on the cot in the sheet? That's not realistic. And why you didn't do it in the first place, so why are you doing it now? Everyone else got body bags. Why doesn't she get a body bag?
I don't know. So I took it that she was still gonna possess other people, and we could potentially get a sequel.
Yeah, I took it that way too, especially because, like, one of the things with the dad when he was dying was he has to live out what happened to her. Someone else has to live out what happened to her for this curse or whatever to be gone. And I don't know if maybe that breaks the curse or that just makes her stop haunting whoever. Because maybe she'll just forever just be haunting everybody, no matter if someone lives it out or not. Like, okay, this person survives, so this person's free to go, but next place I end up, whoever fucks me up, they're gonna suffer, so I don't know.
Well, the next person that does an autopsy's fucked because that guy took all the stuff out of her, all the clues.
Yeah, I don't know how that worked either. They were talking about, like, there was something weird. They were talking about, like, oh yeah, they were saying that she was still alive, but they removed all her organs and everything else, and it's like, she can't still be alive. The son was like, we removed her heart. How is she still alive? How's blood still pumping through her? That was definitely super weird, but I guess it goes along with the curse thing.
Right.
there is a possibility to do a second autopsy. So when we do an autopsy in the state of Arizona, it's up to the forensic pathologist whether they need to do an autopsy or not. So if it's a sudden, unexplained death and they have no medical records, no way of knowing how the person died, they can choose to do an autopsy. If it's also a homicide or a suicide, they can choose to do an autopsy as they need to. Drug overdose, they need to know why the person died. And the doctor can choose to do an autopsy based on their professional opinion and everything. First autopsy is done by a forensic pathologist working in the medical examiner's office, at least in the state of Arizona. This is how it works. So the first forensic pathologist who does her case, whatever county she dies in, whoever dies in, they will go to the medical examiner's office of that county, and the doctor will decide whether or not to do an exam. And if they do an exam, you go through all the organs, and the doctor will look at the organs and take sections of the organs to look at and everything else, sometimes to look at under a microscope. If they're looking at it under a microscope, it's like teeny tiny sections, by the way, not this whole chunk of brain. But once the doctor has cut through the organs, what happens to those organs is they go into a biohazard bag, and that biohazard bag goes back with the body. So if someone ever wanted to do a second autopsy, if the body hasn't been cremated, they can go back through the organs that are in that bag. And usually if the body's gone to a funeral home, they'll put the organs in the body with preservatives. So the whole body, because that's the point of burial, is that the body gets preserved, unless the family doesn't want the body preserved, which can happen. But the main point, usually for most people, is to preserve the body and put them in a coffin and put them in the ground. So if a second autopsy wanted to be done, it is possible to do a second autopsy. The doctor who did the first examination, the pathologist who did the first examination, their cause of death is the cause of death on the death certificate. So everyone has a birth certificate and everyone has a death certificate. And that death certificate is really helpful for insurance purposes and a whole bunch of other paperwork stuff. But whatever that first doctor said for the cause of death is what goes on the death certificate, and you can't have that changed.
Have you ever had to do an autopsy on an exhumed body where they had to like exhume an old body and re-autopsy it for some reason?
There have been cases where the body has been exhumed. Usually it's past the point of doing an autopsy, and it goes more towards our forensic anthropologist to look at the bones and see what they could find within the bones and the skeleton and everything else. We've had a couple cases that our office didn't think an exam was necessary, or somehow the death didn't get reported to our office, so it went straight to a funeral home, and the funeral home embalmed them. And then it came back to our office later. Someone was like, hey, no, this death never got reported to the medical examiner, so they need to look at it. And it comes to our office, and they're already embalmed. And that's a process. That's hard to do, because their body has basically been, they don't actually use cement, but it's cemented the way it was. So, like, when the funeral home is preserving their bodies, their organs get all solid and hardened, and it's hard to do an exam on someone like that. You can, it's possible, but it's not fun, and it's not always easy to see what happened.
Do you have to like pour water in there to like rehydrate everything?
No, so they don't necessarily desiccate and dehydrate. They just become like a solid mass of an organ inside of them. And water does not rehydrate organs.
I thought you said you weren't a doctor. How do you know for sure?
Because we do other things. So in some offices, when you get unidentified bodies, the first thing you want to do is fingerprint them. Some offices, and our office is one of them, that has gotten a system down to rehydrating hands. So if someone's been dead in the desert for a while and their body has kind of dried out and mummified a little bit, we have a process where we take the hands and rehydrate them, and we can fingerprint them afterwards after they've been rehydrated and dried and everything else. So through that process, you can see we don't just inject water into the hands to rehydrate. I know it's called rehydrating, which makes you think of water, but it's actually using chemicals to plump the skin back up and make the ridge lines and the details on the fingerprints available, and so you can print them and everything.
Does it make like a zombie hand look more normal?
I mean, like, zombie hands don't really creep me out now because I'm like, oh, hey, that looks like something I've dealt with at work. And I mean, we make the joke, and I'm sorry if this offends anyone out there, but we make a joke all the time about, like, having the best Halloween decorations. Not that any of us use them for decorations, but we make jokes about potentially having the best Halloween decorations. So.
That's amazing. Do you ever watch, like, Walking Dead?
I didn't, actually. I've never been a big fan of zombie shows. The one I have watched is iZombie mostly. Because that one amused me. I was curious to see how they handled an autopsy in facilities and stuff like that, and that one's been funny to me so far, but that one is so inaccurate. But no, I have not seen Walking Dead, so I'm not entirely sure how they handle it either.
I was just curious if, like, you're like, yeah, that looks like Fred from last week.
Sometimes on iZombie I'll be like, oh, that's pretty accurate. No, that doesn't. They don't get brains to look right. They make brains look more edible and different than they actually look in real life. Like, they make it look like Jell-O almost sometimes. I'm like, that's not accurate at all.
Well, right on. So we have to ask, would you recommend this movie to other people?
If you're a horror buff and you actually get scared by horror movies, I think sure. My problem is, especially with a lot of horror movies, they don't scare me. This one didn't necessarily scare me. Like, some of the stuff at the end was kind of creepy, but I don't get too scared at horror movies, so I don't watch horror movies too often. But I think for people who really like horror movies and really like the jump scares and the other, like, creepy things that can go on and don't take into account a whole bunch of logic, this would be a really great movie for them and they'd find it interesting. But if you're someone like me who applies a lot of logic and is like, why are you opening that door? That door is obviously going to have something bad behind it. This is just a rookie move, man. Like, I'd recommend it. I think it's a good thing for people to see and start questioning. And, you know, our job isn't a hush-hush kind of job. Like, we're not in the business to not tell people what's happened. Our stuff is public record after a certain amount of time. Mainly for the high-profile cases, those ones won't be public record right away, but eventually things become public record. If you want an autopsy report of someone, you can request it, and you pay a fee, and you get the autopsy report. In the state of Arizona, that's kind of how it works. So we're not doing anything secretive. We're not trying to hide what we do. People ask us questions, we'll answer them as long as it's not identifying information. I know my office, they personally do a whole bunch of interviews for a whole bunch of news stations on a regular basis, especially during the summer, because we deal a lot with border crossers, and that might be a giveaway of where I work, but oh well. It's not a thing that we want to hide from people. This is people's This is people's taxpayers' dollars paying for this kind of thing. We're not trying to keep it hidden from anyone. So information that I feel I can give to you or give to anyone else, I'm going to give. I'm going to tell people stories because my job is interesting and people are interested, and I think the more people know about it, the better off they are. Because I've had people ask me, oh, what do you do? And I tell them where I work, and they're like, oh, so you work with doctors, like in a hospital and all this stuff. And I'm like, no. Obviously, I do work with doctors. I don't work in a hospital. I don't work on live people. I don't do, like, a whole bunch of stuff that you're thinking right now. It's totally different, you know, like, I don't mind educating people. I have no problem letting them know stuff. So if they have questions, as much as I can answer, I will answer, so...
Well, I love that you were so open and honest, and I had talked to you before, so I don't think that I could have gone to anybody else and asked the questions that I asked you, you know, but I've hung out with you, so I knew that you were cool, and I knew that that I could ask you the craziest shit, and you knew that I was interested, but also that I'm just being a disgusting trash person.
And I'm sure if you knew any of my other coworkers or people I've worked with and you asked them questions, they would answer your questions. I haven't met anyone who doesn't like to share the stories of work.
Right.
It's
right.
like anyone, wherever you work, you got stories to tell. So
not nearly as interesting as yours, and you definitely have a crazy job, and you are not a crazy person, which is good. I mean, you like have other things that you can talk about other than like grisly, scary stuff. And we went to Comic-Con together, so I know you're like a huge nerd like me, and you like all the Comic-Con stuff. So
absolutely.
That's
I
super
dressed
exciting.
up at Comic-Con. You weren't dressed up at Comic-Con, but I was dressed up at Comic-Con.
What were you dressed up as?
Oh, mine was so low-key. I thought Alicia told you. I was Amy Pond.
Who's Amy Pond?
Oh my god, Doctor Who. Do you know Doctor Who? If you don't know Doctor Who,
don't
not
know
gonna
Doctor Who at all.
See, that's the problem. But that just proves how nerdy I am, because I watched Doctor Who and I dressed up as a character. But it was a super low-key costume. It wasn't supposed to be, like, super obvious, and, like, people who knew the show knew I was dressed up kind of thing, so.
That's the coolest costume at Comic-Con, where people, you can just, like, see the same nerd as you and be like, yeah, what's up? You know what's up. So our final portion of this podcast is called Fuck, Marry, Kill, Fight.
Man.
And in honor of our Dead podcast, I decided to pick all dead people for your Fuck, Marry, Kill, Fight.
Tell me who you'd fuck, marry, and kill. This game is the definition of thrill. You have to pick, you have to choose. If you don't, you will lose. Tell me who you'd fuck, marry, and kill. Who you'd fuck, marry, and kill.
Fight.
So,
All right,
here
we
are
go.
your choices. Abraham Lincoln, Kurt Cobain, Hitler,
Oh, jeez.
and Albert Einstein.
Okay, obviously right away we're gonna kill Hitler. Can I, like, fight him and then kill him in the fight? Because I want to do that. I want to keep that. Like, I have problems with that.
My co-host Brian Gunn always tries to cheat and do the, can I kill him, can I fight him till he's dead?
I would like to try that too. I'd like to fight Hitler until he dies. I think I've got some moves and some anatomy knowledge that I might be able to kill him, maybe, possibly.
I think more than most you do, yes.
So Hitler's obviously dying. Somehow, some way, Hitler's gonna be gone. I'm not gonna tell you if I'm gonna fight him. He's just gonna be dead. That's all you're gonna know. You might not even know he's dead because I'm gonna hide his body and you're never gonna find out. So Hitler's obviously gone. Abraham Lincoln, Kurt Cobain, or Albert Einstein. Okay, so the thing is like if you marry them, you don't sleep with them, right?
Nope, you have to have a sexless marriage.
Okay, so I feel I might. Oh man, this is a hard choice. I would marry either Albert Einstein or Abraham Lincoln, and I'm kind of leaning more towards Einstein because I have some questions about Lincoln's morality. But then that means I either have to fight Lincoln or fuck him.
That's what's glorious about this game, is that as you whittle it down, you start getting tough choices.
Right. Okay. So maybe let's do it this way. Let's marry. Oh God. No, I think I'm still gonna marry Albert Einstein. So kill Hitler, marry Albert Einstein. I kind of want to fight Kurt Cobain. I kind of just want to, just to say, guess who I fought? I fought Kurt Cobain. Then that means I sleep with Abraham Lincoln, and I don't know if that's a good thing or not.
I don't know.
I think that's gonna be my order, but I don't feel confident in that order.
I think if anybody, that he's going to be the freakiest one in the sack, for sure.
That's a good question, too. I don't know, I'm thinking, like, Lincoln was super tall, right? So maybe he's got a good proportions going on.
He had, like, giantism, so I guarantee he's thick in the finger. Nobody cut down his cherry tree. Oh, that's Washington.
Wrong president. So I think my final answer is that I'd fuck Abraham Lincoln, I'd fight Kurt Cobain, I'd marry Albert Einstein, and I'd kill Hitler all the way.
There you have it, folks. That is a great answer and a great way to end this show. I want to thank everybody for coming. I want to thank Persephone for taking a long time out of her day to talk on this podcast and answer all of our questions, both important scientific questions and then completely dirt person horrible questions. She answered them both. She never once called me a disgusting filth bag and said, I will not answer that. So I want to thank her for that. And I want to thank all you guys out there for listening. I hope you enjoy these episodes. Feel free to get onto Instagram, Facebook, and YouTube. Tell us how we're doing and what you like and what you don't like about the show. Also, we're doing a new thing where if you do a rate and review on iTunes, Alicia will sing your rate and review. So that is a good reason to get on there and write something wacky to make her have to sing it.
She makes amazing songs, people. You
She
should
really
make her have to
does.
sing your review. She's great at it.
Yes.
Fantastic.
Make it happen. So, this is what we say at the end of every episode, Persephone. I almost called you by your real name. We say, if you're not talking poop, you don't know shit. So, if you're not talking poop, you don't know shit. All right, thanks everybody. Have a good week. All right.